This is Group 1, Nicole, Jana, and Peter. We will review a 30-second commercial intro, the phase of sleep that our medication is targeting. We will also define the phases of sleep, review indications for use, FDA approval, major interactions, side effects, contraindications, warnings, and patient teaching.
Does this look familiar?
Do you have trouble falling asleep? Do you miss the days that you could have dreams and wake up in the morning feeling well rested and not have to worry about being addicted to a medication that helps you sleep? Well, look no further. You can get a good night's rest with Ramelteon. The phases of sleep include wakefulness, which is non-REM, stage N1, which is dozing off, a very light sleep. You may get a sense of falling. Stage N2, sleep onset. This is a light sleep where your body temperature drops, your heart rate and respiration are slowed. Stage N3, your muscles become fully relaxed, brain activity is slowed. Stage N4 is restorative sleep. Your body repairs itself during this sleep. Growth hormones are released. And then there is REM sleep. This is when acetylcholine peaks, brain activity increases, heart rate increases. This is when dreams occur. Ramelteon is prescribed for sleep onset insomnia, which occurs and works on stages N1 and N2. Ramelteon is a melatonin receptor agonist. It assists in falling asleep quicker. It works similar to melatonin, which is a hormone produced in the pineal gland that regulates the circadian rhythm. It reduces sleep onset latency, it increases sleep periods, and the biggest thing with Ramelteon is the minimal risk for dependence, tolerance, and abuse. It is non-habit forming. Ramelteon is an 8 milligram tablet taken at bedtime. Ramelteon, or Razorem, is FDA approved for insomnia. It is indicated for other sleep disturbances such as primary insomnia, chronic insomnia, transient insomnia, and insomnia caused by shift work or jet lag. Common side effects include sedation, fatigue, dizziness, and headache. It can cause respiratory depression or angioedema in rare cases. You must be careful if taking medications that are CYP450 inducers or CYP450 inhibitors because it is metabolized by the CYP450 system. Caution with medications such as rifampin. If taken with this medication, the plasma levels of Ramelteon would be decreased. Therefore, it would not work as well. If taken with Luvox or ketoconazole, medications that are CYP450 inhibitors, the plasma level of Ramelteon may be increased and cause more sedation. There's an increased risk of respiratory depression when taken with other CNS depressants such as alcohol or benzodiazepines, so patients should be warned not to combine these medications. It is not recommended for those with sleep apnea, depression, those who are pregnant or breastfeeding, or for children. It is taken once a day, 30 minutes before bedtime. If taken with a heavy or high-fat meal, the efficacy is decreased. Patients should be warned not to take this medication unless they are planning on having a full night's sleep. They should avoid alcohol, cannabis, or over-the-counter drugs that may slow any action. This medication may inhibit memory of driving, making and eating food, and sexual activities. Notify your prescriber if pregnant or breastfeeding. You may sometimes feel dizzy or weak, so make sure that patients are aware of the risk of falls when getting out of bed, and also that they should not be driving after taking this medication. Notify your prescriber right away of any signs of allergic reaction, new or worsening mood or behavior, confusion, memory loss, suicidal thoughts, angioedema, decreased interest in sex, nipple discharge, amenorrhea, or trouble getting pregnant. Thank you.